A deadline changes everything. This is serious. This is real. We are the ones that can make this happen. Our leadership is the only way to achieve the mission. Now, many of you know I'm a 26-year breast cancer survivor and president of the National Breast Cancer Coalition. We are a collaboration of activists, survivors, researchers, policymakers, grassroots groups, and national organizations that have come together as disruptive innovators for social change. We are many different stakeholders working together to achieve our mission. We know we are stronger together and that real progress can be made if we use our collective power and focus on a plan of action to end breast cancer. You are here because you want to be a part of that. So welcome. Now, I'm going to have to walk that line again that I do every year between telling stories that, for those of you who have been with us all along, induce groans and not again reactions. And for those of you who are somewhat new to NBCC, will give you a better context for the next several days and years. Now, I vividly recall my introduction to the National Breast Cancer Coalition. That was 1991, 3 years after my diagnosis of breast cancer at age 39. I was a partner in a law firm, mother of a 14-month-old son, and a community volunteer. A small group of women invited organizations from across the country to come to Washington, D.C. to hear about a new idea, a coalition of organizations to focus on political action, to change the systems of breast cancer research and access to care, to figure out how we could influence all the areas that affect breast cancer, to become breast cancer activists, to go beyond awareness and mammography to actually end the disease. And a movement was born. 20+ years later, NBCC continues to thrive, defying the conventional wisdom that so many competing interests could never stay united. We kept that coalition together, and doing that was hard, frustrating, difficult, but amazingly gratifying work. The women I met in the room in 1991 were not content with simply talking about what needed to be done. They carried that talk into action and launched this revolution that is the National Breast Cancer Coalition. Now, NBCC has a long history of being a leader in the world of breast cancer, taking on big issues, challenging business as usual, facing controversy head-on, and achieving success. And indeed, in many ways, the entire history of NBCC has been about doing what everyone else says is impossible. Certainly, pretty much everything NBCC has done has been controversial, but at the same time, so very strategic. We know it isn't enough to just pound the table and demand change. We figure out what that change should look like, how to make it happen, and educate ourselves to be a part of it. When we came together in 1991, we wanted to change the systems of research, care, and policy, not just one aspect or line item. We wanted to change everything that affects all of us. And as we were building this incredible network of advocates across the country, we began to realize the unprecedented value of this network. These were women and men from all walks of life who were willing to share in and dedicate themselves to our mission. We had to respect that kind of commitment. We had to be certain that whatever NBCC took on, it would be of enormous impact and worth the advocates' invaluable time and effort. We had gained their trust, and we would never misuse it. We set a mission to end breast cancer, and I cannot tell you how much pushback we got for that. We were told by many scientists and other breast cancer groups and the government that you can never end a disease. You can't end breast cancer. But we knew we could. When we decided as our first step to increase federal funding for research, that was a strategy. We knew that private events, runs, dinners were important, but would never bring about the kind of money needed to make a real difference, year in and year out, in science. We knew that could only be through the federal appropriations process. And we also knew we didn't want to just throw money at the problem. We were strategic. How much money could the scientific community absorb in 1992? Where were they in the search for answers to breast cancer? We didn't want any of the money wasted. Our research hearings led to a plan for the government to spend an additional $300 million more, from $100 million to more than $400 million in 1992, and that launched the Department of Defense Breast Cancer Research Program. That was incredibly controversial. Asking for that much of an increase, using DoD dollars, it made us lots of enemies. But we were not deterred, and we were successful. And access to care, daring to question the idea of federal funding for screening, but not treatment. It was NBCC that wrote and pushed the CDC Breast and Cervical Cancer Treatment Act, creating a system of access to care for thousands of uninsured women with breast and cervical cancer. For those of you who were not there, you must understand that there was a great deal of opposition to our strategy. Other groups worried that we were going to harm the screening program, that, quote, entitlement programs should not be expanded, that there really wasn't a problem. Our way was controversial, but we did it. And we wanted to be certain that we had a say in how research dollars were being spent and what type of care women were getting. So then we launched our education and training programs, of which Project LEAD is the most well-known. Unprecedented, difficult training to make certain advocates had a seat at all tables where decisions were being made, and to make a real contribution once there, to insert ourselves in the clinical trials process. All so very controversial, but we did it. We disrupted the system by significantly increasing funding, getting the DoD involved, putting lay advocates at the table with a meaningful role, demanding a say in what research happens, expanding access to care for the uninsured. We constantly challenged ourselves to do better, to make the world of breast cancer better. We truly changed that world. We changed the world of breast cancer like no one else. But to what end? Around 2008, we began to take stock at an entirely different level. Is it enough to bring billions of new dollars to the scientific community? Is it enough to get a seat at the table? What had we really accomplished? Where are we? We've brought about more than $3 billion new dollars to the research community worldwide. So many lives lost. We brought about new research mechanisms, but we get the same old questions. There are many new treatments, but not real breakthroughs. We are nowhere near where we need to be. So we asked ourselves a very tough question, keeping in mind that incredible network of advocates whose trust we've gained over the past 20 years. If the national breast cancer goes away, what happens? Well, the status quo continues, whether we're here or not. We and the success of the breast cancer movement may have created a new status quo. The scientific community expects that we will continue supporting the DoD program, but we expected them to do things differently. The breast cancer world expanded. There was a constantly expanding pink explosion, but the issues, the real issues, were buried in awareness and fluff. There are many stakeholders now invested in the business of breast cancer, and that includes nonprofit groups. Who is at the table? Are they advocates who know what they're doing, who challenge, who question, who are informed by others or just their own personal agenda? Has the system moved to just checking the advocate box? Could substance once again be heard through all of this? So what do we now bring to the world of breast cancer? We knew we had to bring back urgency to breast cancer. If we were going to stay in this fight, we're in it to win. Just being here is not enough. So after much analysis and discussion, we set a deadline. And a deadline changes everything. This is it. We launched the deadline in 2010. It's 2014. We are in the middle of it all. We have made incredible progress on the research side, bringing together the right people to work on the issues we identify, innovative approaches, big questions, real solutions. The science is moving forward. We now need more of a public groundswell behind this deadline. This is where you come in. NBCC has never focused on marketing ourselves. There are no funds for billboards, publicists, or advertising. We've always focused on doing the work. Our structure, a coalition of organizations working together on the overarching goal of ending breast cancer, is exactly what is needed to achieve that goal. It is not a great structure for raising money and raising visibility. You are the leadership of that network of advocates, and you are the resource needed to raise the profile of the deadline everywhere. We're giving you the tools you need to make that happen. At this summit and beyond, we're putting you in touch with the people who know how to do this and who have a proven record of success. People like Carolyn Lucasmeyer and Andy Burnett, experts in creative solutions and grassroots organizing. We're giving you the knowledge of an understanding of how the system works or doesn't work and what is needed to get to the end of breast cancer. People like Dan Sarowitz, Alicia Jackson, experts who are challenging the system like Stephen Friend, and old friends like Sue Love, Bob Cook-Deegan, and Leslie Bernstein. We're making certain you are updated on the deadline science with visionaries like Keith Knudsen, Alana Whelm, Kim Lyerly. You will be hearing from innovators and Era of Hope scholars funded by the DoD program that you made happen, like Stephen Johnson, Jay Debnath, and Stuart Martin. We are giving you the leadership tools. You are formidable. Ask yourselves, will you run with it? What role will you play to create a world without breast cancer? Why are you here? What is it you will do? Do you really want this, the end of breast cancer? Because it's going to be really difficult, challenging, uncomfortable work. A deadline for the end of breast cancer? Oh, it's not possible. I'm sure all of you have heard that. It is not possible to know how to end breast cancer by 2020. Science doesn't work that way. Well, it should. Science must answer to us. Discovery, serendipity, all of that is important, but it's not the end goal. We have to take what has been discovered over the past many decades of our successful fight to get enormous funding for science and apply it, not as the basis of the next proposal for funding, but apply it to save lives, to end breast cancer. Those who say it's impossible, that it's silly to try, what are they afraid of? Failure? I've actually been told that one reason some scientists do not like the deadline is because if they fail, it will turn the public against science, and they will no longer support funding for it. Really? You know, it isn't that failure that will turn the public against science. It's the failure to dream, to create, to take risks, to collaborate. That is what will disturb the public. And why wouldn't you want to try? And why be afraid of failure? Because we've already failed. Despite years of campaigns to raise awareness, ever-expanding screening programs, increased fundraising efforts, and research, we're nowhere near where we should be in terms of preventing breast cancer and preventing deaths from it. We've seen some progress. We've extended life for some women with metastatic disease. Mortality rates have declined, but nowhere near commensurate with the investments made in research and awareness. Breast cancer remains the second leading cause of cancer death for women in this country and the leading cause of cancer death for women globally. In 1991, in the United States, 119 women died of breast cancer every day. 20-plus years and billions of private and public research dollars later, that number is 108 every day. That's one death every 14 minutes. This year, nearly 40,000 women and roughly 400 men will die of breast cancer in this country alone, more than 10 times that figure worldwide. By 2030, it is estimated that if we continue along this path, globally, 750,000 women will die of breast cancer that year. That should not be considered success or even meaningful progress by anyone's standards. And this is an important fact. The incidence of women diagnosed with advanced breast cancer has not changed. The rates at diagnosis of truly lethal disease have remained stable since 1975. All of these reasons are why we launched Breast Cancer Deadline 2020. Now, I want you to know what we have accomplished already. We not only set a deadline, we developed a blueprint and a plan of action on how to achieve it. There are actions to be taken by government, science, and advocates. We looked strategically at what each stakeholder group must do and what they can do. What role should the government play in the deadline? Now, if this were 1961 and John F. Kennedy were president, he might have launched an Apollo project to end breast cancer, giving the government the lead in the campaign. But this is the 21st century, and there are too many government bureaucracies in the way of real leadership to end breast cancer. So we brought together various experts to help us figure out government's role in the new reality. We designed the Accelerating the End of Breast Cancer Act to make certain our government took on the necessary role. With your help, we have been building bipartisan support for this legislation, and on Tuesday, we will push even harder to get it enacted into law, because this is the year we need to get it done. In science, we took the lead, figuring out what big questions need to be answered to achieve our mission. And then we designed research projects, created collaborations, launched the Artemis Project, identified the people to bring together, and then asked the scientists to work within our framework In the Artemis Project, over the past couple of years, we've created a dynamic process that will lead to the answer, whether we can have a preventive vaccine in breast cancer, and if we can figure out how to prevent metastasis and end deaths from the disease. We've expanded the group of people working on the issues. We held meetings with multiple groups of stakeholders to examine specific issues such as immunology, tumor dormancy. We developed and launched information sharing tools so that all involved can continue to collaborate virtually. A committee of advocates looked at what is already going on that is relevant to the Artemis work, like the availability of tissue, issues in prevention trials, issues with data, and we're working on how to incorporate what exists with our plans. And through the generosity of the National Philanthropic Trust, we funded seed grants totaling around $1 million with plans for another $1 million to be granted this year. But this work is not just about a preventive vaccine and preventing metastasis. It was about creating a new model of science that truly put the patient, trained patients who are advocates like you, at the center and at the head. And we are applying that model to a number of other questions. We've launched outreach projects and expanded our Center for Advocacy training to include online training to change the conversation in breast cancer so that the goal of ending breast cancer is the context within which everything happens. We are doing our part. Ultimately, though, success will depend upon those outside of the National Breast Cancer Coalition, the leaders in industry, in government, in the scientific community, in the advocacy community, all of us, all of you, all of them, to do their part. It will depend on funding. The budget for our deadline work is over $150 million. Each Artemis project alone costs $10 million. Now, many researchers want to work with us on the deadline. I've heard from scientists who attend our summits, who work on the Artemis project with us. They say how their involvement in this unique approach helps them think differently about their work. They form new collaborations that will get answers more quickly. Let me tell you about one of them. Yaniv Ehrlich at the Whitehead Institute. He was recently profiled in the journal Nature. Now, that's the very journal that chided NBCC for setting an impossible deadline. Yaniv is one of our Artemis Project collaborators, and he has said a number of times that he believes that this is a high-risk, high-reward project, out-of-the-box thinking that can really change the course of breast cancer, and something scientists do not get to do that often. Now, I want to quote him. I'm going to quote exactly what he said. He said, "I love this project because it brings people from different areas, from different expertise. There is no competition over here. Everyone has the same goal. Some would describe it as pure, and I really agree with that. There is a clear mission, and it is something that can really change public health. And I just love this project." You know, he's not alone in his eagerness to be a part of this deadline. That is the type of leadership and courage we need in science. But this is not just about science. It's also about advocacy. Over the past 20 years, I've seen a troubling change in this movement. In the beginning, we were eager to march, to shout, to push. And then many of us became too comfortable in our day in the sun, no longer willing to challenge. We didn't want to upset the scientists we were working with or Congress. We wanted to be the ones invited to the ceremony at our senator's office. Too many of us became complacent. You don't end breast cancer that way. You become part of the problem. So how do we revitalize this movement? We're doing it in science. We need to do it everywhere else. What are you afraid of? We have to increase our grassroots mobilization efforts, and you're going to learn new approaches to achieve that goal at this summit. We should be picketing at scientific meetings. We should be everywhere with signs and banners. Deadline 2020. Are you with us? What are you doing to get there? We should mobilize the public, get them riled up about this. At the same time, we're interacting with researchers and policymakers. What are they doing? Do they know what is happening? Do they know how to be a part of it? We will give you tools to help you with these efforts. For Project Lead graduates, you will get survey and interview resources to help us describe the landscape of breast cancer research. For all of us, community organizing efforts such as deadline roundtables and media outreach efforts. All of those at risk and all of those who care about them must join this revolutionary activist movement with the goal of ending breast cancer. Now, you play a meaningful role in this campaign. In order to reach the deadline goal, the campaign must gain support from a diversity of groups and organizations, not just those focused on breast cancer, but all who care about and understand the importance of this issue. Since the launch of the deadline, more than 300 organizations have endorsed the campaign, and that number continues to grow. This expanding list of endorsing organizations demonstrates the breadth and diversity of the breast cancer, women's health, and healthcare advocacy community that stands behind Deadline 2020. But we need you to help get more organizational endorsements. Is your organization signed on? Is your institution signed on? How many others can you reach out to? You've been with us, and you've helped us accomplish so much. Our greatest achievement is yet to come, and we cannot do it without you and without your support. Now, many of our member groups focus on extremely important specific issues: young survival, HER2, metastatic disease, triple negative, collateral damage, disparities, and they should. But we must all come together to work on the overarching issues in breast cancer, on the strategy to end breast cancer. Now, we can achieve our mission to end breast cancer with the right planning, passion, leadership, and funding. You know, it's been more than 20 years since NBCC was founded in 1991 with a mission to end breast cancer. Are we close? Nowhere near close enough. Has there been progress? Yes, of course, but not enough. Those women in that room back in 1991 were not part of NBCC to cure their own breast cancer. It wasn't about them. They launched and nurtured this movement for their daughters, their granddaughters, their sons, for future generations. And it is for those future generations that we launched Breast Cancer Deadline 2020. We will know how to end breast cancer by January 2020. You know, I get that this is scary. I get that this may shake up your standing in breast cancer. I get that it is hard. But if not us, who? It's more than time. I've reminded you many times in the past that, you know, we stand here in the shadow of giants. Pat Barr, Ginny Sofa, Kendra McCarthy, Denise Smith-Jones, Annette Drummond, Pam Onder, Carolina Hinestrosa, Maria Wetzel, Chris Brunswick, Karen Noss. Too many leaders gone. Too many to name, but not too many to remember. Isn't it time we stop losing the women and men we love to breast cancer? No more status quo. Deadline 2020. You are the only ones who can make that happen. Thank you.